on record. And we're going to see if there are any new people here. We're looking at the names to see. It looks to me like there have been everybody who I see has been here before. Kyle seems like a new name to me, but you may have been here before. How did you find out about the classes if you are kind of relatively new? We're just kind of curious. And unmuting, there's a little microphone at the bottom of your computer screen, the lower, I guess, left-hand corner.
All right, you got it now?
Now we got it.
Yes. Scott Wagner got me onto this class, and I had some high cholesterol and overweight. So year I'm right at about 40 pounds. And my numbers are looking better. Last time I got checked, I still got some work to do, but I'll keep at it.
Well, great. Glad to have you. Thanks for stopping in and come to a few classes and see how it goes, for you.
A lot of the classes, I just never speak up. So.
Oh, okay, great.
Yep, I've listened to everyone this year, and I think I've heard just about every one of them over the last few years. I just never did get onto the whole system here until this year. So.
Okay, well, thanks for sharing that with us, and keep at it.
Yeah, and thank you guys too for all the stuff you do.
Thank you. Anybody else who is relatively new? I'm going to kind of mute everybody initially here because it's a little scratchy in the background. And so I'm going to mute everyone. And then, okay, we've gotten rid of the excess noise. And when it's time to speak, you can unmute yourself. Is there anybody else who is brand new that hasn't shared, how you found out about the classes? And we're just kind of curious about it, Scott and I. Now Eric, too. And maybe everybody's been here before. I see a one in the chat. How long does it take for inflammation to leave your joints when you stop eating? So, Scott, do you want to deal with that question before we carry on?
Sure. I guess it would depend on what you're eating, what your diet and lifestyle was like before. So let's just say, for argument's sake, you're eating a typical standard American diet. Let's just say, let's go with the worst case scenario. You're eating a standard American diet, you're sedentary, you're not sleeping well, you're not exercising, you're smoking, kind of like doing everything that could cause chronic inflammation. All of those things I just mentioned would cause chronic inflammation, which could lead to things like heart disease, diabetes, autoimmune disease, arthritis, stroke. I mean, pretty much name your disease and it would contribute to that. So if you suddenly went on a whole food plant-based diet, so no more animal products, no more processed foods, no more oils, you started exercising, you quit smoking, and you were sleeping better, all the things we talk about in these classes, then that would give you the best chance to totally reverse inflammation, chronic inflammation. So if you had inflamed joints, you had rheumatoid arthritis, or you had just generalized arthritis, you would be doing everything to put yourself in an anti-inflammatory state and really make a huge difference. But that's a big extreme from one extreme to the other. But any movement with all of the different things that we talk about in the classes, a more plant-centered diet, moving in that direction and doing other positive lifestyle changes we talk about will move you in that direction to decreasing inflammation. It's just going to be a case-by-case basis as to how much inflammation you have, how much damage has been done in the joints, for example, as to how much of a effect you're going to get and how quickly. And someone that's really extreme, that has a lot of inflammation, like say someone with psoriatic arthritis or rheumatoid arthritis, we would, say, hey, I would go all in on it if you can, if that's something you can do, and maybe even read Dr. Brooke Goldner's book, Goodbye Autoimmune Disease, which we have on the book list on the class website, where she recommends a whole food plant-based diet and like lots of green smoothies and lots of water and kind of some other things that can really reverse autoimmune disease and chronic inflammation as well. So that would be an even deluxe version of what we're talking about, and because she put her lupus into remission with the diet and lifestyle changes, and many other examples of many other autoimmune diseases that were put into remission with these diet and lifestyle changes. So yeah, it's a big topic. We have a whole class dedicated to autoimmune disease and arthritis, and so we'll dive into that deeper at that time.
I've had a number of people after 2, 3, 4 weeks, sometimes 6 weeks, where they've had significant relief of discomfort. So it can happen pretty quickly, and just stick with it. You're going to not only get some benefits in that area, maybe great benefits, but remember there are other reasons for doing this also. So keep listening and learning about the science. There were a couple others, Jennifer Owen and company. You're new. I know your microphone's not working, but welcome. Hang in there with the classes. You can shake your head. Have you been to the website to see where the archive programs are? The programs we started in January? Okay. If you go there and look at the introductory sessions by Scott and by myself, that's really probably a great place to start. We'd encourage you to do that and then just browse through whatever else might interest you. And keep coming to class, have fun. Anybody else who wants to share anything with the group before Dr. Colgrove gets started and continues on? Someone has a question about Candida. Recently diagnosed with it. What is it? I lost the chat. Do I have to give up potatoes, grains, rice, and all fruit based on what some people say? Well, based upon what some people say, no. Based upon science, I think I would go by what Dr. Greger has to say, and I doubt that he would tell you you'd have to give up those whole plant foods. I think he would say you really want to make sure that the diagnosis is correct. And I don't know if you have anything to add to that, Scott, in terms of your experience, but I do know that a number of people have been diagnosed with this problem because no one could find anything else, and people were not doing a totally whole food plant-based diet. So they came up with this candida overgrowth kind of issue, and the person who diagnosed it has a special supplement to take, which is the only thing that's ever going to clear it. So be careful about where you're getting your health information from, and get maybe a second opinion about that. What do you think, Scott?
Yeah, just it's more of a problem of dysbiosis, which means the gut microbiome is not optimal, not ideal, and so maybe there is a little bit of overgrowth of Candida species, which is yeast basically. I know Dr. Greger has some videos on that. I think the science shows it's kind of overblown and not most often not clinically significant in any way. It's kind of more of that disease mongering stuff where you try to a little bit too reductionist science, where you're trying to tweak all these little things, and whether they have clinical significance or not is dubious, is doubtful in the science. But we would just say, all the lifestyle things and whole food plant-based diet to get the best gut microbiome, lots of wide variety of whole plant foods. And Dr. Will Bolsowitz in his Fiber Fuel book is the go-to source for having a healthy gut microbiome. That book's also on the class website under the books. And then, you could also go to nutritionfacts.org and do a video search for Candida. And I think I'm pretty sure Greger has a few videos on that.
Okay, Edward. And Eureka. I,
He's sleeping.
okay. In the palm of your hand.
Yeah.
Can't forget Eureka. Go ahead, Edward.
Okay. Oh, hi. So I've been losing weight, like a lot of weight, really fast. And I just want to make sure that it's not too fast.
You want to make sure it's not too fast. So you look at your BMI, you know your height, you know your weight. And if your BMI is above 25, you say, hey, I can keep losing weight till I get down to 19 or 20, no problem.
Okay.
So looking at you in the picture, I'm saying, I don't think you have a problem at this moment. I don't think Eureka is worried about it. Unless you're stealing some of her food to maintain your weight. But other than that, I have found the vast majority of people, they lose down to kind of their ideal body weight and then they stop losing weight. As long as you're not hungry through the day, you're getting enough calories that way, you're getting enough protein, you're getting enough what you need. If you're eating plant foods, you're getting enough fiber. And you lose down to your ideal body weight and then you stop losing. Now, some people, they're worried about their image. Their family members are saying, oh, you're too thin. You got to gain some weight. You need to eat more, because they're looking at the pictures of what everybody looks like today compared to what everybody looked like back in the 1940s and 50s when they actually looked normal. And now they're comparing you to what most people look like now. And most people, like 60% or more, 2/3, are overweight in our country. So yeah, you're going to be underweight and people are going to be griping about that with you. So that's my thoughts. Anything else, Scott?
No, that's
Okay.
good.
And Kristen, if you ever want to chime in, it's okay too. And Eric too. Anybody else?
Thanks. Sorry about that. My dog was barking, so I kind of missed the last couple minutes. But,
that's
but
okay.
thank you.
Okay. And even Lisa, if she wants to chime in, that's good too. It's good to see you all here tonight. We're thrilled. So I think we're pretty good. I think we want to let Dr. Colgrove go ahead and continue on. And then our last session, we really loved it. Thank you for doing that. And we appreciate you coming back for a repeat performance or whatever, an addition. So carry on.
All right. No, I'm very glad that people are here. You might not have a child yourself, but everyone's got a grandchild or a niece, nephew, or you're going to have a child at some point in the near future, whatever. You know, this information may not be relevant for you right this second, but it's still important information. And for the parents out there, I hope we've made things clear, and certainly I want to do more talking with y'all, answer questions and have it a two-way discussion. So, but first I wanted to kind of just review just a little bit of what we talked about last time. We talked about how breast milk is the primary food in the first year of life, and hopefully the mother can feed for even longer for those ongoing benefits that you get from breast milk. It's really not, we've kind of gone through some yo-yo in our country about what is good with breastfeeding, and we know now that this is really the food, really for the first couple of years of life. This is it. This is really the most important food, really, especially in the first year of life. It's extremely important. If you can't breastfeed your child, there shouldn't be anyone guilting you about it. There are definitely other alternatives. We talked about those last time, but kids can start solids at 6 months. And so we talked about what that is like, starting solids at 6 months. And I had a request to play the baby-led weaning video again, since we had some problems with technical stuff. So I might do that if we have time at the very end. We'll see if you're interested in that. Yeah. we did talk about things that you should avoid, like in the first year of life, you should avoid honey. We talked about avoiding fast food, talked about avoiding highly processed foods, of course, for kids. And one of the most important things is really, I don't know how much I talked about this last time. I did a little bit, but avoiding food as reward or punishment. I mean, it just, food should have nothing to do with reward or punishment. It really is a completely different thing. And so many people use it as a bonus. You get a bonus if you clean your plate, or if you eat that whatever, or some kind of punishment. Yes. So it really, food has nothing to do with reward and punishment. I don't know if anybody has any thoughts about that. How did you guys grow up with food? Was there a lot of reward and punishment in your upbringing? Anybody? Yeah.
My guess is we all have.
Yeah, I
Like,
think so. Yeah.
I know it's like, oh, you finish your vegetables, you can have dessert, that kind of thing.
Right. And if you've done really well in school or something, then we get this special treat, and that's really, still, food should not be used as that special treat. You should be treating your children, but it shouldn't be a behavioral manipulating kind of thing. That's usually how things can go awry, and you get more. We have so many eating disorders in the world, and just not even the extreme eating disorders, but just your relationship with food is not where it should be, not healthy, because we have this reward punishment thing that's connected to food. We all, yeah, I think you're right, Scott. We all do. We all have been raised with some of that. So I really try to encourage parents to completely dissociate those two things. Yeah. The other thing I wanted to mention was last time somebody mentioned that, if you have donuts out and you've got some good food out, or some healthier foods out, people are going to go for the donuts. But I wanted to make sure you guys understood why that's the case. Does anyone know why that's the case? Like, yes, we know that things like donuts and other very processed foods, those things stimulate our dopamine centers very strongly. And this is an important thing, because you want to have, as a caveman, as an earlier species, we wanted to have things that were more dense, that would stimulate our brains more. And so it was really a protective thing. Though people, obviously, it's something that was passed on through many generations, and that's because the people who were able to find good sources of calories survived, and so that gene was passed on. But boy, it's really kicking our butts now, because that's not what we want to do, is search for the densest calories. And so those processed foods, that donut is just so packed and dense, it just lights up our brains. And whereas that strawberry, yes, it tastes good, but it's not quite as dense. So if you have two side by side, they're wonderful. They're both are gonna look like they're wonderful to us, but one's obviously going to be healthy and one's not going to be nearly as healthy, even though it's going to light up our brain even more. So I just wanted to mention that again, because we kind of talked around it last week. I just wanted to address that. Does that make sense? Anyone have any questions about that? About why donuts are more interesting than beans? Let me stop my computer from blurring. Let's see. All right, and let me see if I can get on to sharing. I'm gonna probably zip through some of the slides that might not be, I don't know, it depends what you're interested in. You know, some of the things like things that we should have in our diet, it might be important, but not everyone might be that interested in it. You should just stop me if you want to spend more time on something. But let me get the share screen on. Okay. Oops.
There we go. We see your screen.
Okay. All right. Sorry, I'm just kind of setting up a little bit. Okay. All right. So, yeah. So this was last. This was last time. We talked about the reward punishment feeding at the very end of last week, and I just think it's so important to separate those two issues, feeding and reward and punishment. Just, I don't think a lot of people talk about it or think much about it, but it's just, I'm in my mind, it's just one huge thing we got to get away from. All right, so let's see. Let me just talk about a couple miscellaneous toddler child nutrition stuff. One is this idea of DHA and EPA supplements, so these long chain fatty acid. And really there's a tremendous amount of evidence saying that adequate nutrition is really so important to kids, and that we can get that through plant sources and plant derived antioxidants. But also it's important to get this long chain fatty acids like DHA and EPA. These are things that really maximize the health of our brain and prevent aging of the brain. Some argue that you can produce all the DHA and EPA that you need just without supplementation. So just actually getting short chain fatty acids. What these are things like fats from nuts and greens, things like walnuts, and flax seeds, and those kind of things can actually, you get these short chain fatty acids, and your body can make long chain fatty acids that your brain can use. But we don't know how good you are at converting the short chain to the long chain. So it's variable, and there's a genetic potential that is varying in all people. We just don't know. That we don't test for that. It's not something that you can really know. So it's optimal to get some preformed long chain fatty acids, because that's what your brain needs and uses. And so, and really with our nutrition nowadays, we just don't get enough. Whether you're doing whole food plant-based or whether you're eating this standard American diet, it doesn't matter. You're not getting what you need for optimal brain development. So we should all be really getting some omega-3, and the best would be the algae oil omega-3. Then you're avoiding the fish sources of that, and the fish sources are much more likely to be contaminated with some type of toxins that you just don't want to have to deal with. So I definitely recommend, much like Charlie and Scott, getting an algae oil supplement. And they make chewables, so young kids can get these chewables. You can get them on Amazon. Basically, the best way to find them is if you just put in Amazon search, if you just put in a vegan omega-3 supplement for children. You'll find there's a few of them, and that's really the best way to get that going. Does that make sense, guys? Any questions about that? Scott, Charles, do you have any? Charlie, you have any thoughts about that?
So I'll jump in a little bit.
Yeah.
I've been back and forth on the fence about this. There are, I think in an older age group, there is still considerable debate, and I don't know that the argument has been settled. So I for a while chose to take some of this DHA EPA, but I've stopped. I look at families over the years who have been totally plant-based, and they look healthy to me throughout the years. And so I know we're a very pill supplement-oriented society, and it kind of tends to push us over into supplementing the kids. But the ones I've seen in the past, they sure looked healthy to me, didn't get diseases, and the brain seemed to be developing, although I never tested any of them. So I guess perhaps to be on the safe side, doing a bit of supplementation like you're recommending might be an appropriate thing. But I haven't seen enough of the evidence for adults or children for me to be convinced one way or the other at this moment in time. So whatever choice one makes, I think is okay, whatever you're most comfortable with. That's my thought.
Yeah, there certainly was formula that was made without these long chain fatty acids for many years, decades, and this was not good for those babies' brains. We found out that they actually have better vision and better IQ scores when you actually supplement. And so IQ scores are hard to see when you're looking at a child. It's hard to tell.
Yeah.
And so the other thing is that there are some studies that show that things like DHA and EPA, these long chain fatty acids, are helpful, that they do improve some mild brain disorders like ADHD. It's a mild brain disorder that has been shown that if you take a supplement, it definitely can improve some of your ADHD. It's not going to completely just dissolve it away, but it's something that certainly can play a role. So there is some evidence that it can be helpful in certain things. I would recommend it just because. Yeah,
Well,
I agree. I'm not one that's into supplements either.
Yeah.
The supplement.
For kids, I'm going to go with what you recommend as far as doing the supplementation. For adults, I'm not thoroughly convinced that it needs to be done at this, with the science that we have available. But I'm not an expert on that topic.
Well, the other thing is kids are better actually at converting, is what I understand, Charlie, is that kids are actually better at converting the short chain to the long chain fatty acids anyway. You kind of wonder, well, gee, can we just use flaxseed and chia seed and walnuts for our kids, and then not worry so much about the long ones, because kids are better at converting to the long chain fatty acids anyways. I don't know. Charlie, do you see that in more, is that more in older adults? Do they have a harder time to hear that? Yeah.
I think it's the older adults, the aged people, like the group that I'm in, that may have a problem. Now, my wife was tested and her levels were normal, actually. It was tested by mistake. And whether it was an accurate test or not, I have no clue. And I figure, well, if her levels are normal, maybe my levels are normal, and I'm feeling healthy. And so I'm like, okay, I'm good. I'm going to go with nature at 75 years of age, and I'm not going to worry about it. But that may not be somebody else's choice. Somebody else may decide, because I'm an older age group, doing supplementation is appropriate.
Yeah.
And Dr. Clapper actually has decided, yeah, I guess I'm going to take it to hedge my bets. And I respect Dr. Clapper, but, he's been on the fence about it. He didn't take it all last year. And then this year he decided, okay, I'm going to do it. And yet the evidence is still kind of borderline. Scott, do you have anything to add to this discussion?
No, I think they're good. You guys are good there with what you said.
Okay.
So why did formula companies decide to put these long chain fatty acids in the formula? Did anyone know why that would be? Why would they add stuff like that? Yeah, the answer would be because breast milk does have it, and it's an important part of breast milk. And they were actually seeing differences between breastfed kids and formula fed kids, because year by year, decade over decade, we find new things that's in breast milk that need to be added to our formulas. So formulas are getting better slowly but surely. They'll never completely be as good as breast milk quite. So, but it is getting better and better, and that's one of those things that they did do was make sure that we have EPA, DHA for babies' eye and brain development. Okay, so the next thing I'm going to say was, don't give up when children taste foods that they say they don't like. I mean, it takes 8 to 15 tastes before a child takes a liking to a food. Can you imagine that? So I've talked to so many people who say, gee, that my kid doesn't like this or that. They won't eat potatoes, or they won't eat whatever, anything, kale or whatever it is, anything. And it's because those are different flavors that they're not used to. And so kids, you really have to sort of stimulate the brain regarding that before you just sort of give up on it. People give up just instantly, and maybe they try one more time, but what I see is people give up after once or twice, and really it takes a dozen times. So that's an important thing that you should know. On a totally different note, the next one is, these are all different random kind of things, not really related, but they're important in toddler child nutrition. And that is this idea that we shouldn't sweat the small stuff. When children choose to eat junk food on occasion, I think you should let it go. I think certainly you want them to go to a friend's birthday party, and you don't want them to feel bad about partaking in that party and having a piece of cake or whatever. I think what you need to do is, when they're at home, that's where they're going to get 90% of their intake, and that's where you're going to really ensure that your kids are eating the right kind of foods and you're providing the right foods for them. But when it comes time to going to a birthday party or being at school and their friends giving them some other processed junk food or something, I think we need to not get so bent out of shape about it. You can't really control what is being done outside your home with food. And I think you can try to control it, but I think it's just not worth it. I think it ends up being a strange battle that you can't really, there's no reason for it. Yeah. So you have to really control sort of what food is offered in your home. And hopefully your child isn't constantly eating outside your house. But there are going to be definitely occasions where that's going to happen, and that's good. You want your child to sort of be involved with other kids, and you just have to not sweat it too much. So moving on to child age nutrition, I want I want you to know that kids really want to fit in. So the lunches should really look pretty unremarkable. They should look just like the other kids' lunches, but just more packed with nutrition. They shouldn't be packed with processed food and meats and dairies and that kind of stuff. So, talking to your kids about not lecturing to other kids about their food is also a really important thing. You don't want them to be the little food Nazis at school where they're going around making sure that all kids have the right food. You really have to prep your kids, because otherwise they're going to say, well, gee, if you're talking to your child about nutrition and they're internalizing it, they're going to say, well, gee, I don't want that bad stuff to happen to my friend Tommy, and so I need to explain to Tommy, but why milk is not the best choice for him. And you just really have to tell them ahead of time that you don't worry about it. It's Tommy's parents that need to worry about it, and or not. It's something that's part of their family. But our family does this, where we don't drink this milk, and maybe we occasionally do. Again, it's not something that we want to put too much stress on if it's not 100%, especially in kids. I think we've talked about how when people have heart disease and we want to be more strict about what we're putting in our bodies, because we're already on that edge of going down the tubes. But we're talking about kids here who are really resilient. They're not going to, even though you can sort of start the process of atherosclerosis at a very young age. It's not something that's going to be severe and lifelong when they're kids getting some junk food. So I wouldn't worry about that too much. Let's see. It's kind of like, I guess I explain it like wearing seatbelts. You may not be able to wear your seatbelts, or you may be able to wear your seatbelts a couple blocks, but it's going to protect you if you don't wear your seatbelts. Basically, your seatbelts are going to protect you when you're when you're going on a long trip, and that's the safest thing, just to wear your seatbelts every time, even though you could probably get away with it for just going a block or two. It's not really what you want to do. You want to just get in the mindset of protecting yourself every time. So that's really the way I like to think about it. So let me get down here. Yeah, I think this whole idea of dairy is an important thing, because the government has really gone all in on dairy over the past 100 years. That this is an industry that they wanted to subsidize and really make sure that people are getting, even though the science is not there. That the science is showing that it's just not health food. That this is something that is really not good for us. I see this in my patients, the people who have constipation and acne and headaches and all kinds of things. You remove dairy from their diet and they get much better. So really, is dairy good for our body? The resounding answer really is no, it's not. It's just not. So milk, it really doesn't do a body good. Unlike the campaign that they have so ingrained in our minds, it's been a bit deceiving. It's been a way that they marketed it for decades and decades and decades, that humans needed this to make our bodies healthy, but it's just not true. So I definitely spend a lot of time in my clinic talking to people about that idea, trying to undo this. I always like to say, okay, you and I were raised with this notion that we had to have, in order to have healthy bones and healthy teeth, we had to have cow milk, but it's just not true. So, yeah. It's great for calves it's great for growing a calf from 50 pounds to 1,400 pounds in just like 2 years. If you can imagine, I mean, that's not something that humans do from breast milk, but that cow's milk has to be pretty darn potent to grow that animal from 50 to 1,400 pounds in just 2 years. So, and think about this whole thing, this whole notion of drinking the breast milk of another species, and how weird it would be if you told people that you drank breast milk of a human as an adult or as a teenager or something. But just think how weirder it is that you drink the breast milk of another species. I mean, that's just bizarre. It boggles my mind that people don't think that's weird. It didn't seem weird to me, just like 5 years ago, but now it seems so obvious to me. That's like the weirdest thing I can think of. I don't know. Any thoughts about that?
Yeah.
Yeah.
Or think about drinking giraffe milk. Doesn't that seem weird? That's
Yeah.
no different than drinking cow's milk. So
Right. I love donkey milk though. It tastes really good. No. So I mean, why did we even start drinking milk? It was because it was an easy source of calories. We domesticated animals, cows 10,000 years ago or so. And boy, if you could park a cow next to your house and get this free source of calories and keep people from dying from starvation, which was a real thing, of course, it still is a thing. There are still, communities that don't have calories, and it'd be very convenient to park a cow next to your house and get life-saving calories. But gee, that's from a long time ago, and some people in the world definitely developed genes that could handle that milk, but so much of the world doesn't. And so this evolution to adapt to using cow's milk never really fully happened, because that's just not what we're evolved to do. And some communities just never really developed the ability. They didn't drink enough milk over time, and so hence you get people in Asia and Africa and other places that just don't really can't really use cow's milk efficiently. All right, I'm gonna stop, see if you've got any questions or thoughts. Anybody have anything?
There was a question on amino acids. Do we get enough amino acids with eating plant-based and the right kind of amino acids? The friends are saying, no, you can't get enough healthy amino acids.
Yeah,
Or Eric, do you want to take that?
sure. I think that it turns out that all the amino acids and all the normal kind of proteins, amino acids which make up proteins, they're all present in different foods, in different plants. Plants have all the amino acids, and that's exactly where cows and other animals get them from, is from the plants. So it's not like animals have some kind of magical source of these amino acids. They get them from those plants. So yes, it's totally very easy to get all the amino acids from plants. And do you have to get like a combination of certain plants to get all the amino acids? No, really, it's what you don't want to eat one type of plant and only one type of plant, because you're not really getting the diversity of nutrients from that plant. But you want to get plants from a variety of sources, a variety of different kinds of plants. So it's not the protein that we worry about. And I know everyone's focused on this idea of protein and amino acids and that kind of stuff. That is, it's pitched to us in a way that seems important, but it's really not that important. As long as you're eating good, healthy food, you like any other animal on this entire planet will do fine.
Yeah, so there was a myth that was started back in the 70s or 80s,
Yeah.
by an author who rescinded the fact that you had to combine certain foods, like beans with rice, or the body wasn't smart enough to hold on to the amino acids, but the science shows the body is smart enough, and that as long as you're eating a variety of whole plant foods, you don't have to worry at all about your protein as long as you're getting enough calories. You're not hungry all the time. So I agree with you, Eric.
Yeah, the body is amazingly smart. And this also, I don't know if this is the right time to talk about it, but there's also it reminds me of the idea that when you eat a certain amount of food, like if you eat vitamin B12 or some vitamin like that, it's not necessarily it's not dose responsive. It's not like a linear amount of, if you take more vitamin B12, is that going to get more vitamin B12 in your body, or more iron, or more vitamin D, or more whatever? Not necessarily. Your body is so smart that it knows what to absorb and what to let pass through. So really, this whole, people who get really super caught up on the exact doses of this and that, and really, or how much is in your vitamin versus my vitamin, I just don't think that's reality. The reality is our body is smarter than that, and as long as we have some source in our food, our bodies are gonna preferentially latch onto it and hold it, just like you're saying, Charlie.
So tell your friend who's worried about the amino acids that they should be worried about the fiber that they get in their diet, because they're probably not getting enough.
That's right.
Any other questions or comments from the group? Okay, carry on.
All right. So, yeah, again, I kind of mentioned briefly a second ago about how all the problems that we see with dairy. So I see a lot of eczema, stomach and esophagus pain, reflux, which is spitting up, and heartburn. Just tons of constipation. Every day I think of my life, I see constipation. Yeah, I don't know. How is that, Scott? You see a lot of adults with constipation problems?
Oh, absolutely. Yeah, I just remember one particular patient where I was seeing his wife for lifestyle medicine, and her husband was just coming along for the ride, and she said, "Oh, by the way, yeah, my husband's been eating this way with me, and he has had constipation his entire life since he was a small child. He was, it was in his 60s at the time. His whole entire life, it always had constipation problems. Because just like overnight, he has no more constipation problems. He's pooping like crazy."
Like crazy. Yeah, I saw a girl today her minor complaint was that she was 9 years old. Her minor complaint, she was in for something else, and it was constipation, and she's leaking liquid stool in her underpants, which is encopresis, and that is a bigger constipation problem. It's basically where when your stool comes into the intestines, it comes down as liquid, and it takes a while for the water to reabsorb in the large bowel. And as it absorbs, your stool gets more thick. But if it's already packed up with large stool, that liquid stool that's coming down has nowhere, darn it, has nowhere to go. And so it just kind of leaks around all the form stool, and it leaks around, and it just leaks out of they can't control it. They just leaks right into their underwear, and it's kind of this constant leakage, and they end up smelling, and it's just horrible. And that wasn't even her major complaint. It was like some side thing that I didn't have time to get into. I was like, you just got to make another appointment and come back, and we got to really work on this, because that's a big issue. But she had some other things going on, so we were talking about that. But also, yeah, definitely I see where acne, I had an acne patient the other day where his acne completely cleared once they got him off dairy. And there's all, people do all kinds, spend so much money and time and go to the specialists, all this drama over acne. And acne is important. It really does affect someone's self-esteem. It really is an important issue. And anyways, I saw this guy, and his acne cleared up once we got him off dairy. And he was like, well, why did his big comment was, why didn't the dermatologist tell me this? I mean, we spent 2 years trying different medicines and doing different things. Well, why don't they know this? And I didn't have much to say, because like, I don't know, it's not something that a lot of doctors know about is nutrition, and it seems like they should, but they don't. The other thing would be iron deficiency, diverticulitis, breast cancer, colon cancer, prostate cancer. All these things are associated with dairy intake. It also, there's evidence that suggests that consistently drinking as little as 1 cup a day of cow's milk can increase breast cancer risk by 50%. So there's an association between sex hormones and dairy milk and breast cancer. Of course, cows are lactating, 100% of them, of course, they're making cow's milk, right? So they're all lactating, but 75% of them are pregnant. And so just getting a ton of natural cow hormones into the milk, and that's what's causing some problems. But let me play a video from Gregor about reflux, because it's a good one. Let's see if I can get this going. Okay.
Excessive spitting up and vomiting in infants may be treated with putting them on their left side down after meals, but of course never when sleeping. It's always face up or wake up to reduce the risk of crib death. Also, you can try a small and free.
I don't know why my mouse keeps clicking this off.
Feedings, thickening, or changing formulas, and breastfed infants, which is ideally how all infants should be, eliminating cow's milk and eggs from the mother's diet. I've talked about how more than 40% of infants with reflux can be successfully treated with cow's milk removal. It can also affect them on the other end too. It can be a major contributor to diaper rash and contribute to chronic constipation. In 80% of affected kids, though only a single kid tested positive for an actual cow's milk allergy. So it was like some kind of sensitivity reaction that can really only be diagnosed by giving a cow's milk free diet abroad. Anal fissures in may be practically pathognomonic for cow's milk allergy, meaning so characteristic of the condition that it can be used as a diagnostic sign. No allergy testing required. It's like when cow milk hypersensitivity was demonstrated in 10 of 17 children with severe reflux. In the majority of patients, the hypersensitivity to cow milk was identified only by eliminating it and then re-challenging to confirm. They did endoscopies, measured the acid gurgling up before and after milk, and then verified by repeating milk exposure with double-blind, placebo-controlled challenges when necessary. Yet all but one of the children proven to have this adverse reaction to dairy tested negative on allergy tests. So tested negative for cow's milk allergy, but still got better by cutting the cow's milk out, showing that this association between cow milk hypersensitivity and severe GERD, the severe reflux, was observed not only in infants, but also in older children. Another disease that can be cured with cow's milk elimination is eosinophilic esophagitis, a chronic inflammatory disorder of the esophagus, the tube that connects your mouth to your stomach. Figure out what's causing the inflammation. An elimination diet is prescribed, where you basically remove everything, and then every time you add back a food, they stick an endoscope down your throat and take biopsies to see if that one food made things worse. And how many freaking foods are there out there? I mean, you can imagine how difficult, costly, and invasive this is for families, how confusing and frustrating. So these researchers at Northwestern figured, let's just see what happens if you just remove one food from their diet instead of making them go through all that. And just eliminating cow's milk induced remission in 65% of the children they tried it on. I mean, normally you'd have to put these kids on steroids, where they try to coat their throat with steroids to knock down their immune response, and then that sets you up for infections like thrush. And of course, as soon as you stop the steroids, the esophageal inflammation comes raging back because you're not treating the underlying cause. But steroids are considered the standard of care. Too bad there's never been like a head-to-head test of cow's milk elimination versus steroids until now. A comparative effectiveness trial of cow's milk elimination versus a swallowed steroid, and they both appeared to work just as well, which is to say the cow's milk elimination worked better because no side effects, and you're treating the actual cause, suggesting getting rid of dairy products should be considered the first line therapy. In adolescence, cow's milk protein intolerance can contribute to chronic fatigue syndrome, evidently a common problem in young people with chronic fatigue, and most importantly, a treatable contributor to their symptoms. But again, most were unaware that dairy was a problem, possibly because it can take hours between milk ingestion and when you start feeling worse, so people don't make the connection. So even those who report no problems after milk ingestion may still be suffering problems after milk ingestion. And finally, what about adults? Well, there's lactose intolerance. Most people on Earth are lactose intolerant after weaning, with the exception of some human populations that developed lactose tolerance about 10,000 years ago, thanks to a mutation in the lactase gene, which enabled adult humans to digest lactose, milk sugar, or at least those select European populations, whereas most Hispanics, most Africans, and Asians remain intolerant, which may be a good thing since acid regurgitation, reflux, heartburn, so common among adults in the Western world. And food intolerance may play a role in adults as well. Milk was found to be the leading culprit, but they were using what's called a leukocytotoxic test, where you see how someone's white blood cells react to individual foods in a petri dish. This test is frowned upon by professional allergy associations as not being sufficiently sensitive and specific. Can't hurt though to put it to the test. A double-blind randomized control trial performed in 38 reflux patients for which proton pump inhibitor drugs failed to completely control their symptoms. Okay, well, let's give diet a try. They randomized people to a diet in which they excluded foods they tested sensitive to, most often dairy, versus a diet which instead excluded foods for which they didn't test positive for to control for the placebo effect. A month later, the symptoms in the control group dropped, but the symptoms in the true diet exclusion group dropped significantly further. I mean, they kind of felt bad for the control group, so they switched them to the right diet too. And 2 months later, everyone was feeling better.
Let's see. Okay. Yeah, so we're just talking about how estrogens in the cow milk can affect humans. And so this alarming trend has happened over the past 100 years, and that is the rate at which children go through puberty, especially females. Really, back in the before the 20th century, the average age of puberty in girls was 16 or 17, and the age of menarche over the next 100 years really dropped to now at average less than 12. So it's really remarkable that different things have affected that, but we think the main thing affecting it is the cow milk estrogens. So the typical American diet that's rich in meat and dairy and processed foods basically interrupts the normal hormonal development in adolescence for a number of different reasons, and milk is one of them. But that's a huge one. I think that that we've seen this drop off, but what we're also seeing is that we see increased risk for breast cancer. Really, what has happened is that we know that breast cancer there's an association with breast cancer in women when they are drinking a lot of milk, when they're exposed to estrogens. It's basically not completely understood, but we know that there is an exposure to estrogens that over time, increased estrogen exposure can lead to breast cancer development. So that be an important thing to know. A lot of people don't know that. So the other thing I wanted to mention was just note about the growth of vegan children, and that is that they tend to enter puberty a little bit later. They tend to be a little bit smaller as pre-adolescents, and then as adults they can actually be taller. So this is something that the Western diet seems to be growing kids faster. Not the parents love when their kids grow extremely fast and are way off the curve. I don't try to say that that's a healthy thing. They always want to know that their kids are bigger and stronger and faster and larger than their peers, but it's just not the healthy thing. So I think that vegans tend to be smaller and thinner and enter puberty later, but that's actually how it was meant to be, and that's actually healthy. So. All right. So this is basically. Yeah. Phone's going crazy. Okay. Let me also mention about why plant-based diets are best at satiating, at making you satisfied with food, and that's because just the density. I mean, if you think about 200 calories of broccoli, it's going to be over 6 cups, and 200 calories of Ritz crackers is only 12 and a half crackers. So which one's going to fill you up? I mean, it's really going to be that broccoli, obviously, that's might not be the most interesting if that's all you're eating is broccoli, but that is going to be a significant difference in feeling hungry or not. is when you're actually eating something that isn't processed, that is more natural. Oh yeah, the other myth is, there's some myths here that I wanted to mention, is that the idea that eating plant-based diets puts kids at risk, that somehow they're going to be missing something. We talked about that in protein and the amino acids, but it's just not true. The myth of kids needing cow milk to have those healthy bones and teeth, like we mentioned earlier, it's just not true. The idea that soy is harmful, just not true at all. And then, yeah, this idea that you're going to be hungry all the time. That's the example of the Ritz crackers. Let's see. Okay, here's a good video I wanted to show about preventing prediabetes in children. Get that going.
Prediabetes is not just a high-risk state for the development of diabetes. Prediabetes can be a disease in itself. People with prediabetes may already have damage to their eyes, kidneys, blood vessels, and heart. Evidence from numerous studies suggests that the chronic complications of type 2 diabetes start to develop during the pre-diabetic state. So by the time we have prediabetes, it may already be too late to prevent organ damage. So best to prevent prediabetes in the first place. And the earlier, the better. 30 years ago, virtually all diabetes in young individuals was thought to be autoimmune type 1 diabetes. But since the mid-90s, we started seeing an increase in type 2 diabetes among our youth, particularly in the United States. Indeed, the term adult onset diabetes has now been scrapped and replaced with type 2 because children as young as 8 are now developing the disease, and the effects can be devastating. A 15-year follow-up of children diagnosed with type 2 diabetes found an alarming rate in young adults of blindness, amputation, kidney failure, and death in young adulthood. Why the dramatic rise in childhood diabetes? Because of the dramatic rise in childhood obesity. During the past 30 years, the number of children diagnosed as being overweight has increased more than 100%. Once an obese child reaches 6, they're likely to stay that way. And even if they don't, being overweight in our youth predicts adult disease and death regardless of adult body weight, even if we lose it. Being an overweight teen may predict disease risk 55 years later, twice the risk of dying from a heart attack, more cancer, gout, arthritis. In fact, being overweight as a teen was a more powerful predictor of these risks than being overweight in adulthood. This underscores the importance of focusing on preventing childhood obesity. So how do we do it? From the official American Academy of Pediatrics clinical practice guidelines, the problem appears to be kids eating too much fat and added sugars and not eating enough fruits and vegetables. Doctors at every occasion, beginning soon after a child's birth, should endeavor to give sound advice regarding nutrition and growth so that obesity and its complications may be curtailed. What might sound advice sound like? Well, the chair of the nutrition department at Loma Linda University published a paper suggesting not eating meat at all might be an effective strategy. Population studies have consistently shown that vegetarians are thinner than comparable non-vegetarians. This is from the largest such study to date. A body mass index of over 30 is considered obese, 25 to 30 overweight, and under 25 ideal weight. The non-vegetarians were up at 28.8. The average meat eater in the US is significantly overweight. As one gets more and more plant-based, the average BMI drops. But even the average vegetarian in the US is overweight. The only dietary group that was on average ideal weight were those eating strictly plant-based. So that comes out to be about a 33-pound difference between the vegans and the meat eaters. Vegetarian children grow up not only thinner, but taller. Vegetarian kids grow to be about an inch taller than other kids. Apparently, meat intake is somehow negatively associated with height. I can just hear the Dairy Council now saying, oh, it's because of all the milk the veggie kids must be drinking. No, the veg kids consume significantly less dairy and much lower animal protein intake overall. Meat intake is apparently associated with growing wider, though. School-age children, the consumption of animal foods, meat, dairy, or eggs, is associated with an increased risk of overweight. Whereas plant-based equivalents like veggie burgers, veggie dogs, veggie cold cuts were not, and whole plant foods like grains, beans, and nuts were found to be protective. This may be because plant-based diets are low in energy density, high in starch, fiber, and water, which may increase feelings of fullness, and resting energy expenditure, meaning resting metabolic rate. Eating plant-based appears to boost metabolism, so we just kind of burn more calories at rest, even when you're sleeping. However, we're not sure how much of the benefits are due to increased consumption of plant foods versus the decreased consumption of meat. Either way, plant-based diets should be encouraged and promoted for optimal health. Local, national, international food policies are warranted to support social marketing messages and to reduce the social, cultural, economic, and political forces that make it difficult to promote such diets. For example, although the advice to consume a plant-based diet is sound, questions arise regarding the relative high price of produce. Yes, we can reduce the burden of childhood obesity, prevent the further spread of disease, but we need to ensure that plant foods are affordable and accessible to children of all income levels. Fruits and vegetables may not fit on the dollar menu, but our kids are worth it. Getting diabetes in childhood cuts nearly 20 years off their life. Who among us wouldn't go to the ends of the earth to enable our kids to live 20 years longer?
We also know that it's not expensive to eat plant-based. And that's an important fact too. It's been more established that eating plant-based is not, it's been studied, it's been found definitely not to be more expensive. So yeah, produce can sometimes be more expensive, but when you're talking about eating more simply, beans and rice, and cooking food yourself as opposed to going to restaurants for food, it's just so much cheaper to do it yourself. So I definitely recommend that. On this screen also it talks about, it says the kids menu. That's actually a movie that I recommend. I'm not going to show any of it, but it shows how really elegantly how the school district in San Diego was able to get kids involved with actually growing their own food, little community garden in their school, and then how to cook food and really just be really involved with their own growing and cooking foods. And once it became knowledgeable, once they had the knowledge of cooking and gardening and once they had some experience with it too, they suddenly they became very involved. Kids want to know this stuff, and they really want to be involved with their own health and eating. And so it really was, they were able to show in this school district that they could actually decrease obesity by getting kids more involved in growing and cooking their food, which makes sense that they're staying away from the idea of gotta rush out and get fast food. No, you can actually be involved with it, and once you have that experience, it just makes a load of difference with kids. So I recommend that, called the Kids Menu, which you can see on Tubi. So Tubi has it for free there. Also, I'm going to talk more about childhood obesity and that issue of what's going on in our world with child obesity on July 11th. We're going to be talking more about it. So I'll leave. I want to talk more about that, so we can talk about it then. But oh, here's some other myths. Oh yeah, that kids have to be really strict. You know, that's not really something where the kids have to be more strict because they have a longer life, that they're going to be exposed to this stuff. Well, the fact is, you can probably have a pretty poor diet for a long time and still be okay. But it's important to set up your habits early on. But I don't think it's important to be extremely strict. So I think that's a myth that you can't have a cookie or a piece of cake or this or that. You know, occasionally. And in those situations, especially like I said, with birthday parties and that kind of stuff. I think the other thing would be, oh yeah, well, we already talked about plant protein and meat proteins, so I don't need to go through that. Oh, let's see. Oh, about nutrients. You know, one thing that's important to understand with kids is that kids need to get 35 to 50% of the calories from fat, which is huge. So whole food plant-based adults typically only get like 10 to 15% of their calories from fat. And so kids they just need a lot of extra energy and a lot of fat. They got a growing brain, which is all fat, and they just have a huge need for it. So you don't want to put them on a diet that's low density calories. You want to make sure that they're getting plenty of dense calories, because they just, when you think about it, they're running around. They have small stomachs. They have distractible brains. They are going to be not getting the calories they need, and they're not going to be getting the fat they need. So don't put them on the lowest fat diet that you can imagine, which would be something that I try to strive for. I try to get very low fat, low saturated fat, because I have MS, and that's something that can definitely affect MS is getting too much saturated fat. So I have to be very careful. And I want to also mention that breast milk only contains 6% of protein. 6% of of the calories come from protein. And so you think about, at a time in a baby's life, in a human's life, where you're growing this body the fastest ever, and this breast milk is the only food they eat, and it's only got 6% protein. It's just remarkable that they can do that. Let me move on quickly here. All right. Now let me see if there's anything interesting. I think I'm going to kind of go through these just because we're running out of time. Yeah, here's something about specific micronutrients that you want to make sure is in your kids' diet. And so you can see the different age groups and how much we expect that those kids should have, that they would function best. And in looking at omega-3, there is an amount that's good for your brain. So, you know, like Charlie was saying, well, maybe it's not real clear if that's going to be super helpful for for adults, but for kids with a growing brain, I think it's really important. So I try to get my parents to give their kids an omega-3 supplement. The vitamin B12, especially for those plant-based kids, definitely are going to need some supplement. And here, really not in the first year, but once you're over a year, then we start doing this 50 micrograms daily or 2,000 weekly. So, and that goes up once you're over 65. We get to over 1,000 micrograms daily. Vitamin D, we know we can get vitamin D from sunlight, but really you can't rely on it completely, especially in the Northwest here, especially in winter times. But here's the RDA recommended amount. Let me get the blurs off my computer. Okay, so iron is something else that we think about, but mainly we see it as a problem when kids are drinking too much cow's milk. Really, the cow's milk can be quite damaging to the intestines, and for infants, it can cause this microhemorrhage. You can get actually blood loss in your gut. So it's dangerous to feed infants. It's literally dangerous. It's like a toxin to feed them cow's milk under a year. But above a year, that doesn't seem to cause the microhemorrhage. It's still, when kids are carrying around a sippy cup with cow's milk in it all day long, and they're getting so many calories from cow's milk, that is a bad situation. Those kids get quite anemic. So you're avoiding dairy and eating lots of greens, tofu, and grains, especially ones that can be fortified. You shouldn't have to worry about anemia. I mean, really, that shouldn't be a problem. We still check it as pediatricians. We'll check it age 1 and possibly age 2 again. So we check for anemia, because kids that are anemic at 1 year of age, they can lose IQ points. So it's a big deal. I'm sure I could have used a few extra IQ points if I was, I don't know if I was anemic then, but gee, anybody could use some more IQ points. So it's an important issue. There's the iodine, which is a trace element, but your body needs it to function properly. So it's important to get some source. We talked about food, the sea vegetables in the past that you can get your iodine from. It's one thing you can do is getting it from salt that's iodized, but also you can get it simply from there are definitely multivitamins that have it in it. So I'm not a big fan of supplements and vitamins, but that would be one thing to kind of give you some insurance is a vitamin that's going to have some iodine in it, might have some iron in it. It's going to have vitamin B12. It's going to have all these things. So it can be an easy way. Not all vitamins that will have iodine. Some will have it, some won't. So you want to really look at your label and see what it does have. Let's see, other micronutrients, calcium and zinc. I think we're gonna go past that. Here's if you're looking for pediatric supplements or vitamins, there's a good site here from Plant-Based Juniors, and they actually have where they basically will look at the good things and bad things that are in different multivitamins, sort of the best. There's not one particular multivitamin that does everything. So you really will probably, you're stuck to giving your child, let's say, something that might not have iodine, and making sure that your child's getting some sea vegetables. It's tricky. I think sea vegetables are always a little bit tricky because you don't really know about how much you're getting. And I know your body is smart and everything, but it is possible to get too much iodine and to cause your thyroid to be off in that direction too. So, I think sometimes it's easier to do a multivitamin that does have some some iodine and vitamin D and vitamin B12 in it. You should also be aware that any of the chewable or any of the gummy vitamins typically don't have iron or very little iron, so don't be relying on that. Making sure that your child gets plenty of those other greens and beans and whole grains. That's going to be important. But I can tell you, prenatal vitamins, 100% necessary. Definitely, we need to make sure that every childbearing woman is on some prenatal vitamins. That is an important thing. Picky eaters. Oh, it gives me a headache just thinking about it. So I'm gonna think stop here. We just go through this stuff, see if there's anything else. Oh no, that's good. I'm gonna stop sharing. See what questions you guys have. See if there's any other thoughts or comments about what it was like raising your own children with feeding, so issues you had or growing up in your own families. Any thoughts or questions? Any questions about what I've talked about here today?
Does anyone have any questions about what food, when Eric was talking about the babies and children, they need a lot more fat, like 30 to 50% of their calories from fat. So they need more calorie density because they have smaller stomachs and stuff. Do you guys, he had kind of a list of at the bottom of that slide, some of meals, examples of meals that would contain those foods. Do you guys have any questions about what foods to choose more of, or Eric can maybe talk about what foods they need to eat more of to give examples of that?
Yeah, I think that's a good thought. I think things that will have more fat are going to be obviously things like nut butters, avocado. I always talk about my favorite, one of my favorite first foods for kids being avocado. So avocado is just a wonderful source of fats for young kids. They should be eating some avocado. And if you tell me that your 6-month-old doesn't like avocado, I'd be really surprised, because I have not seen that. And if that's your case, then you got to feed it over and over to just get them used to that flavor. They're 6 months old. They've never had anything but breast milk in their mouth, and so it's going to be different for them. And actually, one trick you can do when you're starting to feed is to actually to take some breast milk that's expressed and put it in a bowl and get some whatever food you want to use, some cereal, some oats, or some avocado, and mix in there and let them have that familiar flavor so that they can easily branch to some new foods. It's a familiar flavor because it's avocado breast milk. But you never thought you could make avocado breast milk, but I just invented it. It's a way you can kind of get those flavors bridged over.
That's great. Joan.
I wanted to know about children with eczema. Have you seen plant-based diet helping that?
I have, a couple things I think that can be really helpful. One is reducing the dairy consumption, and the other is reducing egg consumption. There are other foods too, but those are the two most important ones: eggs and dairy. And so I definitely recommend doing at least a trial. And a trial would be like 3 weeks to go off. And so I would, I don't recommend those foods anyways. Those aren't health foods. And some people think they are, but I'll try to explain why they're not health foods. But if they're not willing to sort of go away from those foods, at least do a 3-week trial off those. I would do a trial of both of them at once. And then if you're really interested, may reintroduce those one at a time again. If you want to keep using those foods, I wouldn't recommend using those foods, but those are the things that I would recommend going away from. Yeah,
Thanks.
good question.
So someone asked Olive's question mark, like, is that okay for more fat in the diet for kids also?
Yeah, right. You know, of course, you got to be careful with choking. And so those little holes in the middle of olives are made to for breathing through when your child is choked on them. Yeah, it's a joke.
That's pretty cute.
But yes,
If you chop them up, they're probably okay.
chopping them up would be fine. Yeah. But yeah, just the shape of them and the smoothness of it, it just makes me a little bit nervous that those kids could possibly be choking on that kind of thing. So yeah. Oh, well, we don't have time to watch that other video again, but that's a fun video, that baby led weaning video,
Yeah.
which shows the good pictures of kids. And I've had these conversations today in clinic that the parent made a comment about how their kid chokes really easily on food, and I explained to them that kids actually gag, and it's a helpful thing for them to learn how to gag and protects their airway. But that video that we saw last week showed that scary looking gagging thing that looks like they're choking, looks like they're gonna die, right? So I was gonna show it again, but I'll show it at some other time. So yeah.
Anybody else have any thoughts? We've managed to go another hour and a half. It went by pretty quickly.
Next week is an open forum unless you had more slides or anything you wanted to discuss next week a little bit if you're available, Eric, but that's up to you.
Yeah, I don't think I think it'd be open forum would be great. I'll be here to answer any questions, and
Perfect.
yeah, we can talk about whatever
Great.
topics.
All right. Well, any other announcements, Scott, about what's coming up or what's doing?
Just we had the walk on this past Saturday. We got the potluck coming up on Saturday, June 17th, and just keep an eye on it's already in the newsletter every week, and go to the Eugene Plant-Based Provider website under upcoming events to RSVP for that. So hopefully those in the area or out of the area would want to come and join on the potluck. Same place we had it last year at Day Island Park in Springfield. So come eat some good food, have some fun.
Should be good. And the walk was really fun. It was really nice talking to people, and I just really enjoyed it. You know, it's people are there of different walking speeds and abilities, so don't feel like you can't come because you're using a walker even, or I mean I have MS, so I'm a slow walker. And who was the woman that was walking a lot faster than me that was using the walker? So I'm going to be the slowest one there. So I'd love to talk to anybody that hangs back. Yeah.
We'll have one every month. That's also up. It'll be up on the upcoming events. We're just trying to decide on the location. We might switch it to maybe the South Eugene High School track, some place where we're a little more contained, because there's a lot of the electric bikes and stuff out there now. So when we have bigger groups, it might be a little more challenging to stay out of people's way.
Well, hopefully the heat doesn't get to us too much. We'll see. It was really beautiful this past weekend, and we'll see how it gets through the summer. And maybe, I don't know, Scott, we might even want to, on some of those hot days, really push up the timing of it or something.
You mean make it earlier?
Yeah, just on, days where it's gonna be 95 or something, I think it's gonna be hard to do it at 11 o'clock, so we might wanna push that earlier. I don't know, something we can talk
Sure.
about later, but
Sure, yeah. If people can get up that early, go at 9 or 10, a little bit earlier, might be better.
Well,
Yeah.
I'm just thinking that if you want to come to Nyhart, Montana, our temperature doesn't get up that high. Just
Uh,
that sounds
That's
good.
great. That's great. Well, thank you all for coming, and we look forward to seeing you next week.
Thanks, guys.
all right,
Have a
thanks.
good one. Thank you.
Thanks, Eric.
Eric. Take care.
All right, too.